Colleague, Dr. Gingrey.
I thank my co-chair. I'm going to start out by giving you a quote. I'm going to read it. 20 years ago, I may have been able to memorize it, but certainly not today. It is to me a new and consolatory proof that whenever the people are well informed, they can be trusted with their own government. That whenever things get so far wrong as to attract their notice, they may be relied on to set them to rights. Thomas Jefferson said that on January the 8th, 1789. I indeed feel like that this is pretty much what happened Tuesday in the Bay State of Massachusetts. The people have set things right and told this Congress, especially this majority and this administration, this president, but really all of us, that enough is enough, that they are tired of the same old in the crafting of legislation, especially massive comprehensive legislation such as we have on these two health reform bills, which certainly have not yet been merged. That they don't like it, that they absolutely don't like it, that we didn't listen, obviously, were somewhat tone deaf to their outcries during the August recess at all the town hall meetings across the nation. And we came back from that in September as the Congress reconvened, and all we did on the House side was change the number of the bill. We didn't make any changes to it, despite the folks out in Main Street giving us a loud, clear signal. So I really believe that this is a moment in time that has been a great learning experience, hopefully for all of us, and certainly for the majority party and the administration. This idea of calling all the stakeholders together, such was done at the White House when everybody who had a skin in the game, whether you're talking about the health insurance industry or the physicians or the unions or any other organization, certainly big pharma, and cutting deals and getting agreement and getting these powerful organizations to sign on to something ahead of time. That's the typical way of doing business in Washington when you're trying to make sure you cover all your bases and you get the necessary support to get something like this that involves 1/6 of our economy massively changed. But clearly the American people were and have been and continue to be ignored. So in a way I'm gratified that it's a teachable moment for all of us. I would say that virtually all the members of Congress that sit here before this panel of witnesses have stood from the very get-go in strong opposition to much of the provisions in the health reform legislation that the President and the majority party are promoting. It is not to say that there is nothing in this reform that we could agree on. That there indeed, to the contrary, are a number of things, in my opinion, that we can and do agree on. And hopefully, as we have this hearing, we can talk about some of those things today, because we have reached the point where it is time, and I think the President understands this. I think some of his recent remarks since Tuesday would certainly indicate that he is ready to maybe to open his door truly to the minority party, the lawyer minority, especially those members who have specific health care expertise, as do the members of the GOP Doctors Caucus who are holding this hearing this morning. We welcome the opportunity, as we have told him on numerous occasions through communication and letters, that we want to sit down and have an opportunity to talk about the things that we agree on and move forward. And I think maybe we've reached that moment. Hope certainly springs eternal on my part, and we will continue to try to do that. We have some great witnesses today. I've read your testimonies, deeply appreciative of your depth and wealth of knowledge, and certainly I and my colleagues look forward very much to hearing from each and every one of you and to the Q&A period after. With that, Mr. Chairman, I'll yield back and look forward to hearing from my witnesses.
Thank you, Dr. Gingrich. Before we get to our panel here, we do want to hear from you, asking all the members just to give a brief opening statement if they wish, and so in the order they appear. Dr. Rowe, do you have a brief statement you'd like to make?
I do. Thank you all for being here today, and just my background a little bit. I just got here a year ago and practiced OBGYN for over 30 years in Johnson City, Tennessee, and I'm glad to be participating in today's Doctors Caucus hearing as we try to get the focus back on enacting healthcare reform that increases access and affordability. Only with true bipartisan reform that is done in an open and transparent manner will we be able to regain the Americans' trust and fix our system. Many of us have argued for months and even for years that there are simple, common sense fixes that we could all agree on right now to increase access to health insurance coverage. These ideas include allowing small businesses to pool their resources to purchase health insurance, curbing abusive insurance industry practices that unfairly lock certain people out of the market, eliminating state lines for the purpose of purchasing insurance, and medical malpractice reform. People all over our great country are speaking loud and clear. They don't want a Washington takeover of healthcare. They don't want special interest sweetheart deals that divide us. They want us to improve on the current system, not scrap it entirely. I look forward to hearing the ideas of the witnesses today and working to find a common ground. In my district, 79% of the people do not want this government takeover, 79%. And I saw a battleground poll yesterday of likely voters, 1,000 likely voters. This was a Democrat and Republican poll that had 91% of the people who had health insurance, either government, or at least 91% of these people were covered. And 91% of them liked what they had, so they're fearful that we're going to scrap what they have. And certainly the ones that I talk to at home the most are our seniors that are the most worried. You take as much money out of the system as this plan does. Mr. Chairman, thank you for holding this meeting, and I'll yield the balance of my time.
Thank you, Doctor. Now to Dr. Brown of Georgia.
I believe that the marketplace, unencumbered by government taxes and regulations, is the best way to control quality, quantity, and cost of all goods and services, including my business of healthcare. I'm a family practice doctor. I'll give you an example of how government intrusion has run up the cost for everyone. When I was in a solo practice in rural southwest Georgia, I had a quality control automated lab in my office. Congress passed a bill called CLIA, the Clinical Laboratory Improvement Act, that was passed into law. It shut down my lab and every doctor's lab in this country. Prior to CLIA, if a patient came in to see me that had a fever, red sore throat, I would do a CBC, a complete blood count, to find out if they had a viral infection that did not need antibiotics, or a bacterial infection which would be treated very well with antibiotics. It cost $12. I could do that test in 5 minutes. CLIA shut my lab down, every doctor's lab down. I had to send my patients over to the hospital for the same test, $75, 2 to 3 hours for one test. You see, if government intrusion gets out of the healthcare system, if we put market-based principles in the system, we can lower the cost for everybody. And I believe very firmly that market-based solutions, not government solutions, is what the long-term solution to the cost of health care will be. I've introduced H.R. 3889, which is a comprehensive, market-based, totally constitutional, according to the original intent, solution to the health care financing problem we have in this country today. I welcome the witnesses here. I look forward to what all of y'all have to say. I hope we can look for common sense market-based solutions, because my patients, our patients, all the patients, every citizen in this country need desperately to have lower cost for their health insurance, their doctor bills, their pharmacy bills, and we can do that without government intrusion. Thank you, witnesses, for being here. I yield back.
Thank you, Dr. Brown. Over to Dr. Fleming of the great state of Louisiana.
Thank you, and it's a pleasure to be with our witnesses here today, and also my fellow physicians, GOP Doctors Caucus. Despite all the controversy that's been going on for months, actually everyone